The number of deaths as a result of the ongoing violent protests and looting in KwaZulu-Natal and Gauteng now stands at 117. We're told the acting minister in the Presidency, Khumbudzo Ntshavheni, says in KwaZulu-Natal 91 people have lost their lives, while in Gauteng 26 people have died. Ntshavheni says there have been 6 incidents of looting in Gauteng, while in KwaZulu-Natal looting has continued. Briefing the media in Pretoria this afternoon, Ntshavheni says an additional 392 arrests have been made, bringing the number of arrests to over 1,470. And so we've been going around the 2 provinces to some hotspots areas and monitoring some areas. Vusi Khumalo and cameraman Ndabe Khumalo are in Durban to find out exactly where. Vusi joins us now. So Vusi, we've been saying that the Presidency says looting continues in KwaZulu-Natal. Tell us a little bit more about that.
Yes, indeed, looting and violence still continues, even though it is not up to a scale that was happening from the first day on Monday or Tuesday up until today. But today, what you have seen is just like it's relatively low. I mean, it's no longer. It wasn't happening as of yesterday or the day before. But what we can also tell you, as we are standing here in front of Addington Hospital, we know that the violence and looting has disrupted a number of services, including the healthcare sector, of which we are told that the MEC for Health in KwaZulu-Natal visited Ekuhlengeni Psychiatric Hospital near KwaMashu in Durban, where 18 computers were stolen, as well as home appliances, including TV screens, microwaves, ovens, and other home appliances. They were stolen allegedly by the looters during the violence that's been taking place or unfolding in the province of KwaZulu-Natal. Well, the MEC for Health in KwaZulu-Natal, Nomagugu Simelane Zulu, also said that a number of people, including patients as well as the staff, are finding it very difficult to even access healthcare facilities such as hospitals and clinics. So they are writing to the National Minister of Police so that they can have a plan to see to it that the nurses as well as some of the patients are being escorted to their facilities so that they can be able to discharge their responsibilities and duties of going to hospitals as well as clinics. As we are here, we are also standing next to the hospital, Addington Hospital. Okay, before maybe I do that, we know that the bodies or the dead bodies keep on piling up. As from yesterday, we had about 27 deaths as a result of looting. But today, the minister did say that we have got 91 dead bodies that are being discovered on the road, on the side of the road, and in a number of incidences where we've got heightened incidents of looting in the province of KwaZulu-Natal. Let me take you through to one of the persons or young lady who was visiting a hospital today. Sisawusitshela nje kafushane ukuthi khona inkinga okuke wahlangabezana nazo uze lapha esibhedlela. Mhlambe kukhona umuntu othe uyamletha, kukhona inkinga ebenayo yokulinda kade usitshela ngaphambilini ukuthi kahle hle kwenzekeni kuwena. Igama nesibongo qala.
Funekaneliswa izingakhulu inkinga esihlangabezane nazo ngenxa lesimo. Kodwa ke okukhulu kakhulu yikho ukuthi asakwazi ukuthi sithole ukusizakala ngendlela efanele nangendlela obade kwenzakala eqaleni. Thina liwe sifikela ngabo 11 emini and libe hleli and kufanele ukuthi sidedele laba abafika abalimele kakhulu ngenxa lento le izimo nje ezingachazeki, and lento is affecta kakhulu ngoba kwesinye isikhathi uthola ukuthi hayi ngoba nakho thina mhlawumbe ukuthi size ngento mhlawumbe engabalekile isuke ibalekile ukuthi kodwa kumele sidlulise abanye abantu abasuke besesimene esiphuthumayo. Thank you.
Njengamanje ukuhamba kwakho uzobuyela kanjani emuva?
Ukuphindela wami emuva njengamanje ngibheka ama-taxi awekho, sizama urequesta Uber ukho, and kumele ukuthi sincinge ngazinyawo ezinye izinto futhi esibhekene nazo la transport ayikho.
Okay, siyabonga sis.
Thank you so much.
Yes, this is Funeka Nelly. She's saying that briefly that she was accompanying her friend who was here, who was supposed to come to the hospital, and when they came in here, they found that there are so many other people who had to be prioritized, the emergency people in the casualty ward. But I mean, her friend had many injuries, so they had to wait from 11 o'clock up until now. She's just got that medical attention, and that now she's very afraid to go by herself because there are no taxis available. So she had to request the e-hailing services.
So, Vusi, just very quickly before I let you go, and Ndabe, can you give us an update of, according to the information you have, the areas where looting is still occurring in KwaZulu-Natal as we speak?
Yes, Merebank is one of those areas, Empangeni, Richards Bay. In some instances, there are other areas of which there hasn't been any looting, such as Ulundi. We know that even the president or the former president of the IFP, Nkosi Mangosuthu Buthelezi, he also had to provide a human shield alongside other people to say to it that to safeguard the town of Ulundi, as well as Umtobatoba. That town hasn't been touched or looted as yet, but there are areas of which the looting still take place. Even here in Durban, at Umlazi, the shopping malls, Mega City, Kwamnyando, and Richards Bay as well. We got a call that looting is still taking place there, as well as Phoenix, which is also another hotbed for racial tensions that are taking place there between the African people who are staying at surrounding areas such as Nanda, as well as the communities of Phoenix. But looting still takes place in other areas of KwaZulu-Natal, even though it is no longer happening at the extent of which it was during the past few days.
Thank you so much, Vusi Khumalo and Ndabe Khumalo, saying that sense has and some sense of normalcy has returned to some areas, but looting does continue in others. So this, as there's an announcement and an addition